You're listening to the Joint Force on AFN the Eagle, serving America's best. Today we're joined on the phone by Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. Sir, today we want to know what's the latest on the COVID vaccine distribution process.
Well, that's a great question, and certainly the most important question in my world over the last several weeks. So right now we are offering COVID-19 vaccinations to all eligible members of the military community here in Europe, and to date we have administered over 60,000 vaccines, and we have fully vaccinated nearly 20,000 people in our military communities across Europe. Our MTFs here in Europe are scheduled to receive more than 24,000 COVID-19 vaccine doses, first doses, over the next 3 weeks. And our goal is to be able to offer at least one dose to every member of the Army military community by the first week of June. And when I say Army, I mean the joint community that we take care of in our MTFs. And everyone who wants to be vaccinated should be able to get fully vaccinated by our goal of the middle of July.
Great. Sounds like things are really moving along. So can you tell me what vaccines are available at medical treatment facilities?
So we continue to offer primarily the Moderna vaccine, which is a two-shot series administered 28 days apart, which we have been administering from the very beginning. But in addition, we have received a limited amount of the single-dose Janssen or Johnson & Johnson vaccine, and several of our MTFs are offering appointments for both. All of our MTFs offer Moderna. Several are offering also the Janssen, and we have 30th Medical Brigade teams out conducting vaccine events as well. And we'll continue to offer the Janssen or Johnson & Johnson vaccine as long as we have supply and until it runs out.
So while we're talking about that Johnson & Johnson, didn't I hear that there was recently a pause on that vaccine?
Yes, that's correct. The U.S. Centers for Disease Control, along with the Food and Drug Administration, so the CDC and the FDA, recommended a temporary pause, but after thoroughly reviewing some of the safety data, they determined the pause should be lifted and the use of the vaccine should be removed. Now, the FDA did add a warning to the Janssen COVID-19 vaccine emergency use authorization or EUA regarding, I think, what most people have probably read in the papers or online in terms of rare clotting events that have been reported among a very small number of vaccine recipients. And patient safety is certainly one of our top priorities, and we take these safety alerts very seriously. But we feel that two things. One, given the overall data that is there, the Janssen vaccine is very safe. In addition, the risk of, bad events occurring from acquiring a COVID infection are astronomically greater than the rate of any adverse events with the vaccine itself. So we feel it's safe, but certainly, we are happy to speak individually with folks who want to talk about the various safety profiles of the vaccines we offer and answer any questions they have.
Great to know. If you've been wondering if you have a choice on which vaccine you get, that's coming up next. It's all right here on the Joint Force, joined by Brigadier General Mark Thompson, the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. Stick around right here on AFN the Eagle.
It's the Joint Force on AFN the Eagle, serving America's best. And today we're joined by Brigadier General Mark Thompson. He's the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. Earlier, we were talking about some of the different types of vaccinations that people can get for COVID-19. So, sir, there's a plethora out there right now. Are people going to get to have a choice of which vaccine they get?
Yes, they will. And so far we've been talking about the Moderna and Janssen vaccines. And what the MTFs that have both will be having kind of specific events for Moderna or Janssen with separate and distinct dates and time for each. So both vaccines won't be offered on the same day, but there'll be distinct days. So, for example, Monday could be a Moderna day while Tuesday is a Janssen day. And the types of vaccine being offered during appointment times will be posted on the MTF social media and website, so beneficiaries will know which vaccine that they're making an appointment to receive in advance, and they can choose appointments to be vaccinated either on a Moderna day or a Janssen day. Now, the one part about this is certainly our supply of Moderna is much greater than our supply of Janssen, and so the number of appointments and days with Janssen will be limited, and we'll continue to offer it until we run out. And really, the important part is two things. Stay tuned to your MTF web and social media sites for them to post on which days they're giving various vaccines, but they can also visit kind of our appointing website, which is www.tricare.mil/vaccine appointments, and that is posted on all of our MTF web pages as well, to find available appointments by location and by vaccine type or brand for which our beneficiaries can make an appointment.
Well, sounds good. So if people are interested in a particular one, all they got to do is head over to that website. But also, sir, I heard something swirling around Europe here that we're getting the Pfizer vaccine. Is that true?
So yes, we are going to get the Pfizer vaccine, but for a specific part of our population, and that is our adolescent age population. So the Pfizer vaccine, which is very similar to the Moderna vaccine, right now has an EUA down to 16 years. And so we'll be getting a supply of Pfizer vaccine to first offer to our 16 and 17-year-old in Europe. And then we also expect very shortly that, and perhaps even this week, the FDA is going to extend that EUA down to 12 years of age. We anticipate by mid-May, we will have a vaccine supply of Pfizer to specifically give to first our 16 and 17-year-olds, and then as soon as the FDA approves that EUA down to 12, we'll also offer it down to 12 years old. So 12 to 17, we'll be able to offer the Pfizer vaccine.
Well, that's good. We got to take care of everyone. So if we can get those teenagers in there nice and healthy, that's a good thing. Coming up here on the Joint Force, we have just a little bit more time with Brigadier General Mark Thompson, the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. You're listening to the Joint Force.
You're hanging out with the Joint Force, and we're finishing up our time with Brigadier General Mark Thompson, the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. Sir, like I said, our time is coming to a close here. What would you like to leave Joint Force Nation with?
So a couple things. So first, always thanks for the opportunity to share this information with our military community. It's a wonderful talking with y'all and talking about the various things that we're doing to try to protect the force and our families. First and foremost, as we mentioned at the top, we have vaccination appointments available. Don't wait. Make an appointment today. I was just on the website before we talked, and there are open appointments at various locations, various of our MTFs. And so please make an appointment. Please go to our web or Facebook pages or visit that website, www.tricare.mil/vaccine appointments. Second, as we talk a lot about vaccines, the reality is what we're finding is what we thought. Vaccination works. We're really seeing some promising data coming from countries that have vaccinated a significant part of their population. Those two prominent countries are the UK and Israel, and so vaccination works, and we really urge people to get vaccinated. In addition, our host nation and the U.S. itself are beginning to make it easier for vaccinated people to travel, eat at restaurants, shop in stores, essentially get back to a normal life. And so those benefits are being offered for those folks that are being vaccinated. So I think, our goal through all of this is to get back to a life that we experienced before COVID, and getting vaccinated is the path there. But keep in mind, when I say vaccinated, that means a full vaccine series. So in order to receive those privileges, so to speak, that our various host nations in the U.S. are allowing, it is only valid 14 days after a single-dose Janssen vaccine or 14 days after the second Moderna shot. So it is really important to get that second shot if you receive Moderna. And really, like as we've talked about from the beginning, getting vaccinated protects you, it protects your family, it protects your battle buddy, your unit, and your entire community. So the opportunity is there now for everybody, and we have the supply, and so we urge everybody to get vaccinated as soon as they can.
Absolutely. And if you missed it before, I'm going to plug it again. It's www.tricare.mil/vaccine appointments. Sir, thank you so much for your time, your information. It's always a pleasure having you.
Thanks for having me.
Again, that was Brigadier General Mark Thompson, the Commanding General for Regional Health Command Europe and the U.S. Army Europe and Africa Command Surgeon. You're listening to the Joint Force on AFN the Eagle, serving America's best.